It is hard to find a place where the reality of post-Roe America has been more dangerous and punishing for women than Alabama. I visited the state last year in the weeks after Roe v. Wade was overturned. Not only was abortion immediately banned in Alabama, but the anti-abortion laws and the state officials who enforced them were so draconian and deliberately vague that healthcare professionals were not even sure it was safe to talk about abortion. I want to play you a piece of an interview that I conducted in August of last year with Robin Marty, the operations director of the West Alabama Women's Center. By then, the West Alabama Women's Center was no longer providing abortions, but Robin and the rest of the staff were dedicated to keeping the doors open and providing the legally limited but important help and health care they were still legally allowed to offer. If I walk in here and I see you, you're wearing a shirt that says medication abortion is extremely safe and effective. And I say, can I get some?
No. I can't say anything. If I were a regular person, I would say something like, a person can go to aidaccess.org and obtain medication abortion without needing a prescription and have that shipped to them regardless of whether it is a legal state or an illegal state, but that person is running a lot of risk of surveillance and should be very careful. That would be something I could say if I were a regular person. I am not a regular person, so I cannot say that to a patient. I cannot say that to anyone. Honestly, wearing this shirt is a risk, and I do it on purpose because I know that this is one way to make a conversation happen and make people think about this, but I can't provide that information that I just provided to you. Everybody else can.
So that's what it's been like for healthcare providers in Alabama since the fall of Roe. And now, after living and working and fighting and surviving in that atmosphere for more than a year, Robin Marty, along with a doctor from Alabama, from another Alabama clinic, are suing to fight this restriction, to protect Alabamians who provide information about legal out-of-state abortions. Robin joins me now. She's the operations director at the West Alabama Women's Center and the author of the new handbook for post-Roe America. Robin, my friend, it's good to see you again. Thank you for being with us. I was confused then, and I'm confused now, right? I've got my pocket Constitution with me. I know that First Amendment. I didn't understand how it was possible that you giving someone advice about how they might get something, or frankly, giving people advice who can't get an abortion in Alabama about what state they can go to and who to call. I couldn't understand how that could be used as a threat. But it really has been used as a threat against people like you and doctors and others who help women with abortions.
It really has. And honestly, I knew you were going to play that clip. And watching it again now that we have filed our lawsuit, that clip on its own terrifies me, because that makes me wonder, is that something that now that we have actually started this action, that they are going to use that against me? And so I'm feeling a little vulnerable at this moment, but also it's so important for people to understand that what I did there was talk to a reporter, and what my staff, my doctor, my medical assistants, anybody wants to do is be able to say to someone who comes in and confirms a pregnancy, you are this far along, this is likely going to be the best state for you to go to in order to obtain legal abortion care.
And certainly we don't ever want to do any of these things to endanger you, although everything you and I did that weekend was dangerous. There was security around us. There were the doctors who help you with that, fall under surveillance. You were telling me that you live and are surrounded by a community of people who are supportive, but the fact is, in post-Roe America, people in your line of work are endangered.
That is true. I would like to say that we're less endangered for what we do when it comes to people being able to access abortion as it is what we do as we try and make people access any of their reproductive health care rights. We are just as vulnerable for helping people access contraception. The stories I could tell about trying to help people, we provide free prenatal care, and trying to get them in to do a delivery is ridiculously impossible because the state is and the doctors are against our providing care. So this isn't just about abortion. It's about people being able to access all of their healthcare needs, especially reproductive healthcare needs. And it's so imperative because we just saw a study just this week that said Alabama now has the highest maternal mortality rate. And for Black women in Alabama, that rate is now 1 in every 100 births.
1 in 100. This is higher than rates in undeveloped countries around the world. There are places like Rwanda and Kenya that do not have anywhere close to that maternal mortality rate. Help me understand the point you just made, though, about how this has imperiled health care for all pregnant people, not simply abortion. What are the instances in which you see where advice you give, guidance you give, or attempts you have to help people? It's not even about abortions. It's about reproductive health.
Well, for instance, right now we are offering prenatal care, especially for patients who are uninsured or who are trying to navigate the process of getting Medicaid, which is not expanded out here in this state. And as such, we continue to provide that prenatal care for them at every point in their pregnancy, knowing that prenatal care is consistent and early is going to be the biggest lifesaver when it comes to changing these rates. Unfortunately, now that we have been operating for about a year, we are hitting the point where our patients are starting to need to deliver, and we are having a very difficult time getting anybody in our hospital system to work with us. What we ideally would want to do is to be able to transfer over that care so that when they do go into the hospital, they are seeing a doctor that they have met before, that already has their records, that is aware of their circumstance and any complications that might be involved. Instead, we are being forced to tell them, here are your records, take them with you when you go, and you're just going to have to give them to whatever doctor is there. They can't pre-schedule for inductions. They can't do anything like that. And our patients are poor. Our patients are ones who have not had preventative health care. They are diabetic. They're older. They have heart issues. And that we can't just provide the best care possible, especially as they head into delivery, is horrifying. And to have doctors who say to us, well, maybe if you can't do delivery, you should not be doing prenatal care, in a place where doctors are having prenatal care appointments booked 3, 4, 5 months out. That's horrifying to me.
Yeah. Robin, you're strong. Stay strong. Stay what you're doing. Thank you so much, as always, for making us understand this, even though there's danger to you and your colleagues and the people in your state who are trying to fight this. And you've always said to me, don't give up on Alabama, because, this is the kind of, Alabama's the canary in the coal mine, and we're seeing that to be true. Robin Marty is the operations director at the West Alabama Women's Center. She's the author of several important books, including the new handbook for a post-Roe America. Stay where you are. We got more Velshi after a break.